help with remote area medical.
Saturday, Sunday, we'll be there all day. And yeah, I think we'll be put to work and do all sorts of different things. We don't really know what we'll be doing.
We'll just help out with whatever needs to be done, paperwork, getting patients in and out. Maybe not necessarily anything to do with dental, but who knows?
We've seen some video footage of this remote area medical, and it looked like a really, really good project that people have put together, and a lot of medical treatment is given to people who cannot otherwise get it. And it's not just dental, it's everything.
Do you have a nice nap?
Get all of our bags. Can you slide me that little blue one right there?
This one?
Yep.
Here you go.
Thank you. It's okay.
Morning.
Morning.
We just got up. No, stop it, Chris. We were sitting in the lobby waiting for you guys.
Oh, yeah, right. I got hygienists and dentists on here.
So when we come in, they'll have that paperwork, and then we need to take in supplies
Okay, so
from under the bus. So grab something. They're expecting us. They said from Parkland.
As the group from Parkland arrives, they are met at the door with paperwork. Among it is this form, explaining why the trip from Illinois to Tennessee was necessary for Parkland to participate in a remote area medical expedition. In May of 1995, Tennessee became the first state to pass the Volunteer Health Care Services Act, which allows care providers holding valid licenses or certificates in any state in the United States to provide their health care services on a volunteer basis in the state of Tennessee. The bill was created by Remote Area Medical, the brainchild of this man.
I lived for many years with a tribe of Native Americans called the Wapushanas. We had no doctors even up until the time I left there many years after to take care of the people. So the idea then for Remote Area Medical was actually born in the Amazon.
Stan Brock started the organization in 1985, and it wasn't long before RAM expanded its focus past the Amazon.
And then we found over the years that there was just about as much need here in the United States as there was down there in the Amazon. I don't think that the need is any more today than it was then, despite the economic turndown. The need in this country for people that can't afford health care is enormous.
Brock's right-hand man is Ron Brewer, the RAM director for the state of Tennessee.
Our main focus is to treat the uninsured and the underinsured. We, of course, do general health. We do from women's health, mammography, and just general health in general. And also vision. We will do a full eye exam. We have the capability with the eye lab that we take with us on the road. We can make up to 250 pair of glasses a weekend. Also, we do dental, which is we'll do fillings, cleanings, and extractions.
Recent media coverage has spiked awareness of RAM, increasing the number of people who seek treatment at expeditions.
In 2009, right now, I'm booked with 22 clinics, and I'm booked solid through 2010. But we do at least one a month, and some months we'll do 3.
Despite the large numbers of people that RAM is reaching, many more could be reached if more states were to adopt laws similar to the Volunteer Healthcare Services Act.
The greatest impediment to providing this type of care is the ability or the non-ability of doctors in the United States to be able to cross state lines to provide it, except here in Tennessee. In Tennessee, we got the law changed. So if you're a doctor or a dentist or a veterinarian anywhere in America, you can come here, show us a copy of your license, roll up your sleeves and get busy. Nowhere else in America are we allowed to do that. We've had lots of requests from Illinois, people in Illinois, organizations in Illinois, to take our teams to your state to provide care. But we're not allowed to do that because everybody has to have a license in the state of Illinois. So I'm sure that if we were to spend a week in Chicago, we probably would see 10 or 15,000 patients as we do in some of the other places that we go to. But we're not allowed to do so.
Day 1 got off to a slow start,
The morning was a little bit slow. We didn't have a lot to do.
but it wasn't long before the students were put to work.
Seems like a lot more people are coming in, and there's a lot more jobs to be done.
We're just rotating around trying to do everything. We have OHI, we have the sterilization, we have the extractions, hygiene, 3 chairs.
As the morning developed, most of the students found themselves rotating from station to station, either assisting dentists, cleaning teeth,
I'll have you open for me.
sterilizing instruments, or performing OHI.
What you don't want to do is brush really, really hard.
OHI stands for Oral Hygiene Instruction. Prevention is just as important as maintenance, and Parkland's dental hygiene students wanted to utilize the RAM clinic to stress that. So as the lines grew, they took the time to demonstrate the proper brushing and flossing techniques to anyone that would listen.
What you want to do is take your toothbrush and angle it into your gum line, and you want to vibrate really gently, and you'll feel it in your gums, you'll feel it, and then you can sweep away, and that's going to get all the plaque and bacteria out of your gums so that you can brush it off. So if you would like a toothbrush and some floss, if you give me a demonstration, you can keep it.
Pass the test, and the patient walks away with a new toothbrush, some floss, and hopefully a new outlook on teeth brushing.
We had an 11-year-old boy that was really sweet that came over and was really interested, so that always makes our day when somebody's really interested in what we're doing.
Talked to some people out in the front. We talked about teeth brushing and the importance of keeping your teeth clean, how to floss and how to brush. Handed out toothbrushes and toothpaste. And now we're sterilizing instruments as fast as we can. They're really busy.
Sterilization is definitely a dirty job, but the Parkland volunteers have it down to a science.
So we have this whole little assembly line thing going here. And it goes from here to over there so they can get put in the ultrasonic.
And with the amount of people waiting to be treated, every job being done is an important part of the process. Midway through day 1, the greatest need is for teeth extractions and fillings.
The 4 dentists that we brought, I think, are mainly doing extractions. They're staying busy, and we'll just see how the day goes.
We've extracted quite a few teeth from, 8 this morning. Basically been doing extractions all day.
The second-year students have spent a good amount of time cleaning teeth in Parkland's clinic. But with all the dentists hard at work, a new opportunity is available.
I think we also have some students actually assisting dentists, which they may or may not have done that before.
I started off assisting a dentist with extractions, and that was very interesting because I've never assisted before. And I don't have any assisting training, but I got a little bit today.
Certainly a lot of hands-on learning with the
assisting, it was great because I quickly anticipated what he needed, and that part was fun. I think I would enjoy doing some assisting. I'd like to do the dental hygiene and assist when I might not have a patient. So I like that part a lot.
What's great for the students is also great for the dentists.
They've helped me out quite a bit, everything from sterilization to assisting. I think some of the hygiene students are doing some prophies. They're getting a lot of experience, so it's just a wonderful thing.
As the dentists continue to work through the long line of people who are in need of extractions and fillings, the group from Parkland decides to take things into their own hands.
We have a lot of dentists here today, so they are taking most of the dental chairs that were made available. So we really only have about 2 to 3 chairs that we can use for dental hygiene, but we have a long line for people that need cleaning. So what we're trying to do is do a makeshift, set up makeshift operatories over here so that we don't actually have to take space that is needed for restorations and for extractions. So we have students working, we have registered dental hygienists that came with us working. We just felt the need was so great that we decided to try and do it this way. Obviously this is not perfect, but we're doing the best job we can with the facilities that we have, and we want to see as many people as we can.
While the conditions are not ideal, the future hygienists are adapting well and at the same time realizing they have things pretty good back in Champaign.
We definitely are realizing how spoiled we are at Parkland. We have everything we could possibly need or want, and now it's a little more primitive here, and it's a little more challenging, but it's been good.
Despite the setting, all the patients are more than grateful to be receiving the treatment they need.
Today I received a mammogram and a pap smear. I had my blood pressure checked and all kinds of things like that. Then I also had an eye exam, and then I had a dental cleaning. I don't have health insurance or vision insurance or dental insurance, so if I had worked a full 24 hours, I still wouldn't have been able to pay for any of these services. So it means a whole lot. The girls have been great, and I'm their last patient, so they've been excellent to me. They're glad. It's been a very long day on these girls.
The first day of work is almost finished, and the numbers of those that received care are staggering.
Right now we have over 600 that have come through the door and registered. We handed out 600 numbers starting at 8 o'clock last night. All the numbers were gone by 5 o'clock this morning. I think that this is going to be a big weekend. I think we'll probably see about 1,300 people.
Just as staggering is the real-world experience received by the volunteers.
It's a great experience. I think whatever they do, whether they're doing sterilization, oral hygiene instruction, assisting dentists, I think it's all really good. I think they see that it takes so many people, there's so many people in need, and it takes a lot of people to run an organization like this, to volunteer. So it's a good experience for them.
Oh, this is great. There's nothing like it. It's just a situation where you just never find that in normal office or anywhere. It's great to be able to be a part of this.
This lady really needed to have work done on her mouth, and I think we got a great deal of stuff done for her, so that was great. Really great. She was very appreciative as well, so that also was very nice.
When they go back to the program, to their program, they'll take this experience and be able to build from it. They will definitely be one step above their peers that maybe haven't done something like this.
Well, it was wonderful. Exhausting. I don't think I can hardly feel my legs now, but I'm so glad to be part of it. It's been a wonderful experience. I'm looking forward to tomorrow.
Although day 2 got off to another early start, the entourage from Parkland was much more relaxed.
You'd be assisting with fillings.
As they mapped out the day's assignments at breakfast. Soon after breakfast, the chairs down below go from empty to full, and the volunteers from Champaign settle in for another long day on the floor. Like the end of the first day, Parkland starts off the morning with makeshift cleaning stations, complete with flashlights and folding chairs. Speaking of flashlights and folding chairs, they are also key components of the triage area.
She's the one with 8 and 9, right? Yeah.
The triage is used to determine what type of dental work is needed for each patient.
Extraction 19. Well, you'll get it done now, I tell you, because you're the second in line right over there. So
Working at this station provides a gruesome reality into the dental problems of the uninsured.
I got to work with the dentist and kind of look in everyone's mouth and see, what was going to be the first priority of, you see a lot of things, and it was just definitely so sad to see some people were getting all their teeth out.
It gives you a much bigger picture of dentistry, of the need that is out there, and I think once you do something like this, it kind of changes your life as far as there's a lot of need out there, and you have something to offer, and you have to continue to do that.
As the patients go from the triage to the dental chairs, the future hygienists continue to assist dentists and clean teeth. In fact, the demand for cleanings is much bigger than the previous day, providing the opportunity for more hands-on learning.
I worked a lot in sterilization, taking apart needles, putting things in the biohazard trash. I helped with some cleanings. I assisted a little bit. Basically just been floating around, changing positions.
Service learning that's just the best thing about it is, you take what you learn in the classroom and then you actually get to get out and put it to use, see other professionals, at work and work alongside them, watch them, interact with them, get up early, work late, do whatever is needed. You just pitch in wherever's needed. I just love that about an opportunity like this that you don't get at school.
The little jobs cannot be forgotten on this day.
Go ahead and pick a toothbrush for you.
As the students continue to provide oral hygiene instruction, sterilize instruments, wipe and prepare trays, sharpen tools, and sanitize dental chairs. All these tasks are like cogs in a machine. If one breaks down, the whole machine will, making the process at Remote Area Medical that much more amazing.
I think it's an awesome project. I was very impressed by the way it was organized and handled. They put a lot of people through. They had everything all set up, so really we didn't have to do anything except treat the patients.
Yeah, I thought it was a great experience as well. All the patients were very appreciative of our services, and I was just glad to be able to do it.
Since Parkland brought a large contingent to Knoxville, it seemed as if they took over the floor on day 2. Sporting their yellow smocks, a look from up top gives a clear picture of just how much work is being done by the students.
In fact, I don't really know what the weekend would have been like if we hadn't come. We were a big part of the numbers of the people taking care of things here. They would have gotten a lot less done if we hadn't been here.
There would have been a lot fewer assistants for all the treating doctors if the Parkland students hadn't come.
I think they did a great job. They're very professional, and they did really anything we asked them to do or needed done.
And that professionalism was very evident to one veteran hygienist from New Jersey.
This is the most magnificent day I think I've ever spent as a hygienist. Fabulous. What a beautiful group of people. Oh my Lord, I wasn't expecting to see the teachers of hygiene, the students of hygiene. I was not expecting out of this world. This whole group is phenomenal. How lucky these students have come to be able to see what it's like on the outside world rather than in a conformed area that they have 2 to 3 hours to do a mouth. They realize what they had to do, and it has been my delight.
3 o'clock approaches, and Glenda Cooper from Tennessee sits in a chair by herself, representing the last person in line for dental work.
How long have you been waiting?
Since 7 o'clock this morning. Hadn't had teeth cleaned in about 6 years.
In fact, the health section of RAM has already been broken down, but Glenda is more than happy to wait for the service.
It's going to mean a lot because I couldn't afford to do it any other way. And everybody's been real nice and compassionate and, just really eager to help people. And I think that's great.
As equipment is broken down and supplies are packed, the teaching staff from Parkland gets their photo op with the man that made their trip possible. Meanwhile, Glenda finally takes a seat as the clinic is packed up around her. Chair by chair, table by table, and utensil by utensil. As RAM finishes loading up the equipment to take to their next expedition, some of the girls from Parkland decide to take a moment to relax and reflect on their weekend.
It's a really good feeling.
It is.
It's hard and it's tiring, but it's good. I would say it definitely gave us all a heads up as far as
some of the different tools and everything that we don't normally see in clinic and how oral surgery works. You're not going to get this experience anywhere else in school.
It's been really interesting hearing some of the stories. People just been laid off. Good people, hard workers that just no longer have insurance and they just need their help. And I'm glad that we came. I really enjoyed it and really working with the patients is really awesome.
It has been amazing. It's been lots of people served and lots of good experiences for the students. So I'm thrilled that they've had such a variety of experiences. Probably one of the best things is for my students to walk away from Parkland with a heart to give back.
The trip was pretty amazing. It was a lot of work that we put into it, and even before we went, we put a lot of work into going. Met a lot of awesome people, whether they were patients or they were helpers within the organization.
Just getting to know the girls and the teachers more, and then working with different patients and doing different things.
Really good experience, and it was different than I thought it would be. We got to help out a lot more than I thought we would.
We really had a good time, as well as we learned a lot. We helped a lot of people. It really felt good.
We had several dentists go with us, Dr. Holes being one of them, and I got to help assist with him doing some extractions. And I think that was nice, just to kind of get hands-on experience with a professional, being kind of out of our element a little bit. Learning extra stuff, like assisting dentists, which we don't do in our clinic, and cleaning instruments that I'd never seen before was really cool.
Because I assisted a dentist with fillings the whole day, the first day, I really learned that I would like that and that I really enjoy this type of work.
It was more real life, and we got to work more with patients one-on-one by ourselves.
I think a lot of what I'll remember is just how polite and how appreciative everybody was.
Well, I don't have health insurance or vision insurance or dental insurance, so if I had worked a full 24 hours, I still wouldn't have been able to pay for any of these services. So it means a whole lot.
I'll probably remember most the people who said thank you, and you could tell by the way they said it that they really, really meant it.
Just how thankful everybody was and how nice everybody was. Like for how long they waited to still be thankful because they've been there for all day.
It's going to mean a lot because I couldn't afford to do it any other way, and everybody's been real nice and compassionate.
The people that we helped were really great. They really seemed to appreciate everything we did.
It does feel good to help people. Stepping out of your box is a good thing sometimes. I think it went really well. I think it was a lot of fun. I'm glad I did it.
When you can learn and help people at the same time, it's just a really great situation.
Personally, I think it was knowing that even though I'm one person, I can make a difference.
I guess I could just highly recommend anybody to volunteer their time for anything and realize that you can make a difference to a whole lot of people, and it just takes that little bit of effort and you can reach so many.